everyone. Welcome back to another week of Bulletproof Hygiene. I'm so excited to have you joining us this week. And before we really get going deep, I want to just remind you, if you haven't yet signed up for our annual summit that is coming up in June, we'll be hosting it out in Scottsdale, Arizona, June 14th and 15th. And you don't want to miss this, I promise. Come with your whole team because that is how dentistry is done when we do it really well together. So if you want more information, check us out at bulletproofsummit.com. I hope to see you there. So today I'm very excited about this podcast and this episode. I am thrilled to be joined by Dr. Emily Stein. She is a PhD microbiologist that received her undergrad degree at University of Iowa and then proceeded to get her PhD through UC Berkeley and then did her post-grad work at Stanford. She is currently the technical CEO at Primal Health, where she has developed what appears to be a revolutionary approach to addressing dental disease through modulation of the biofilms, thus creating balance and harmony within the oral systemic connection. As a microbiologist, she has a unique non-dental perspective that is really important for us as hygienists to understand when it comes to biofilm and how we can do a better job in managing a healthy, commensurate biofilm. I'm going to warn you that this podcast may be a bit disarming as we come to realize that some of our current standards of care are not as impactful as we may think. But I'm hoping that by the end of the show, we can all ascribe to the beautiful quote from Maya Angelou that says, "Do the best you can until you know better. And then when you know better, do better." So without further ado, Dr. Stein, welcome to the show. I'm so grateful to have you with us today.
Well, thank you for having me.
Will you do us a favor and just share your background in microbiology and how you got focused on oral bacteria specifically?
Yeah, so I first fell in love with bacteria as an undergrad at the University of Iowa. I was, while everybody else was at the bars on a Friday night, I was in a biosafety, biohazard suit on a BSL-2 working with multi-drug resistant tuberculosis. And I just, basically was fascinated by something you can barely see and that could kill you. And that microbe in particular lives in the lungs silently for decades before it pops back out and really causes harm. And so I wanted to kind of really understand how microbes work and how they kind of lurk and use their host to their own advantage. And so then I went and spent 6 years nerding out in soil bacteria, where I worked on community formation. In medicine, we call it biofilm. But really microbes are social beings and they live in a community. And I was working on a species of organism that literally you can't culture it without many of its brethren because it won't grow. It's that social. And so I studied how these microbes work together to survive nutrient deprivation, exposure to radiation, exposure to reactive oxygen species, and antibiotics and antiseptics. So it was the perfect underpinning for what I'm doing now. And when I was a postdoc at Stanford, I was studying rheumatology, which is where your immune system, starts to attack your own body. So we were actually studying periodontal disease as a surrogate because I was in joint diseases like rheumatoid arthritis and that. And there was always a connection between RA and perio.
Yes.
And that's when my grandmother, who had RA, had a stroke because she had a tooth pulled the day before. And she had perio too. And so she was a statistic because retrospective analysis of thousands of Medicare claims have shown there's this relationship between a tooth extraction or a dental implant placement. So there's a 50% increased risk of a stroke or a heart attack within 4 weeks after that procedure. There's and the reason is that the microbes, obviously there's a lot of bleeding during those procedures. The microbes go inside the bloodstream. And for my grandmother, they went, right up her, one of the major vascular highways into her brain, and she threw a clot, and that changed her life. So I changed my life because of it. So I started to biohack my grandma's oral microbes to stop them from causing additional problems. And that's how I got into this.
Wow. Well, I hate to hear that it was such a tragic reason, but to your point, I don't think that we necessarily always realize in dentistry the adverse effects of the actions we take. And we can think, oh gosh, we're doing the patient a favor because this tooth is infected and we're taking it out. But what we now know and understand, and the stats are telling us that 50% of heart attack and strokes are started by an oral microbe, an oral pathogen these days. So I think it's so important for us to all wrap our heads around how important this biofilm is in the mouth and what it can do from a systemic standpoint. So I'm so excited to have you joining us and helping us. So I have to be honest and say that when I started out as a baby hygienist, and honestly, for far too long into my career, I truly had this like mental picture of the bad bacteria, and I knew they were like the gram-negative rods and the spirochetes, but I kind of viewed them as, a handful of them, just kind of living down below the gum line and that sulcus. And that, I almost envisioned that I would go in with my scaler or my ultrasonic and just scoop them out and flush them away. And I thought I was killing them and getting them out and, telling my patients what to do on their home care front so they didn't come back in and rebuild. And sadly, as that was a very naive mental and clinical approach to addressing something so much bigger and way more serious. I've since had the pleasure of working with a microscope to actually see the bacteria present, how active they are, how numerous they are from just the tiniest plaque sample of the mouth. It's just absolutely teeming with very active motile bacteria, and it blew my mind. So that being said, help us start at the foundation for all of this and give us a lesson on biofilm in the oral environment. What does that truly look like?
Yeah. So imagine a jungle like the Amazon, but at a microscopic level. And that is basically what inhabits the mouth. You can't see it unless it really builds up, which is tooth plaque or a thick biofilm on the tongue. But they're there and they've always been there. It is the second most abundant space for ecosystem for microbes, aside from the colon, and we all know how dirty that is. But what I want to basically touch on is the fact that these microbes have been there when we were in our mom's womb. So we co-developed with them. And if you look at all the human elements of the body, including the mouth, only about 10%-ish is human. The rest is really microbial. And so they are constantly growing and constantly eating things and constantly secreting things that our body absorbs. So it's not what you feed yourself, it's really what you feed your microbes that dictate what they do. And so, just to kind of really drive it home, they're living in the pulp of a tooth has its own microbiome. The vasculature in a tooth has its own microbiome. Blood is not sterile. Bone, the alveolar bone is colonized. So everything we were taught in medicine and dentistry isn't quite right.
Well, and I feel like we get, as hygienists, everybody, depending on what aspect of profession you're in, we all tend to get very, focused on your own lane. And I feel like hygienists, we get really focused. We understand perio is an epidemic and we're really looking at that. But I think we get very focused on, like I said, that sulcus, just those little pockets down around the teeth. And we aren't thinking that we've got the tonsil, we've got the palate, we've got the tongue, we've got all these other spaces that we're not spending that same amount of time on to try and disrupt. And then really, what's the reality of just truly disrupting anyway? Speak to that for me.
Yeah, boy, you nailed it. So this is, I don't want to like make everybody sad, but when we brush our teeth or floss, we move the bacteria around and detach them from a surface, but they reattach within 2 minutes. And even though we spit things out, like even after dental cleaning, the burden goes down by, a tiny percent, but is measurable. But they'll creep back up within a couple of weeks to the original number, unless you do a massive shift of the biofilm, which is kind of where what we're trying to focus on is who's living there. We know all those spaces are going to be occupied, period. You know, you can do that you within like a couple of days after a prophy, there's microbes really going to town, establishing their new homes, you know, and you just want to make sure that they're the good microbes making their home instead of the bad microbes making homes, because microbes make homes. Just like
Correct.
humans have shelter, microbes need shelter too. But the cool thing is microbes make shelter out of our diet. And so there's a lot that can be done when you're in the trenches, just educating patients on their diet and diet decisions.
Yeah, and I think, I think so many times, our patients, admittedly, outside of our patients, us as professionals, I don't think we totally understand how big this all is. Patients especially don't understand. So patients are thinking, well, I brush and floss and I get this out, and we're thinking there are over 700 different types of bacteria that can live in your mouth. And I say
Yeah.
to patients all the time, my goal is not to sterilize your mouth. That's not obtainable. And it's not the goal, because true health is having good, healthy bacteria. Like you said, we are honestly pretty alienistic considering how many bacterial and microbe cells we have in our body versus our own human cells.
Mhm.
So the goal is to build that really healthy, what we call commensurate biofilm, the good stuff, because that is truly what health is.
Yeah. And protects you
Yes.
and helps regulate your immune system and keeps your immune system tolerant of your own tissue. And we see that patients lose that tolerance when they get a dysbiosis, which is a fancy word for too many harmful, not enough beneficial in a biofilm. And really that's I think the next phase of opportunity in dentistry for systemic health.
Yeah. So as we wrap our heads around how large of a population this is and how variant it is, depending on what tissue and what structure,
Mhm.
how extensively it thrives. I say to patients all the time, after I've done therapy, I almost envision it as an anthill that we've kicked over. And if you've ever watched that, you kick it over and the ants are just, running like crazy to rebuild. I mean, that's kind of I feel like visually what's happening in the mouth as we do that. And then we think about how much real estate it takes up. I want to ask some hard questions about how impactful our current efforts are when it comes to trying to manage this, because I think for decades, we've thrown fluoride and minerals at trying to stop decay, but is caused by strep mutans. We've thrown scalars and ultrasonics and lasers and medicaments, antibiotics, rinses, and probiotics at periodontal disease, trying to break up those biofilms and killing the pathogens to rebuild a good, healthy baseline flora. And like you said, we know that studies show that the bacteria repopulate back to their original numbers within 2 to 7 days after all of our efforts. So, we think, well, why are we still seeing disease when we've got all these tools and approaches? But what are we missing? And I know you said diet is a huge part of this, right?
Mhm.
So I will tell you, I have the gift of getting to coach hygienists. And I know many hygienists that tell me they don't feel like they have either the time in their appointments or the knowledge to really dig into diet with their patients. They almost feel like that's taboo. Like, I don't want to talk to them about their weight or their diet. That seems a little personal. But I know that based on your research and findings, that this is one of the main things we've got to understand and discuss to help our patients understand when it comes to getting to the root of dental disease. So help us understand why this matters so much, that it's not just as simple as, oh, you ate a piece of candy, or, you have a sweet tooth, or you're drinking soda, that it leads to decay. It's a much bigger process than that.
Oh yeah. So taking a step back, I'm gonna say something that most folks won't like, but what we're taught to give our kids as a healthy diet, which is juice or fruits, actually is really problematic from a not only tooth decay standpoint, but gingival health and integrity. Because when you think about things that have a high sugar content plus acid at the same time, that's a two-pronged driver of creating this environment in the mouth that enables certain microbes, which are acid tolerant, to really go and grow really quickly. in that kind of environment, and it makes it much more difficult for the beneficial microbes, which grow on alternative sources of carbon, which are maybe non-sugar related, makes it much harder for them to hang in there. So they actually can get outcompeted by simple things like an orange juice every morning, or orange juice and apple and, banana, anything super starchy or sweet and acidic, definitely play a role. And also the evolution of fast food and processed foods. I can't, as a microbiologist who spent now, I don't know, a quarter, 25 years in microbiology, tell you what microbes are turning certain of these processed chemicals into waste products or intermediates that do X, because we don't even know. And that's our understanding of nutrition is based on the understanding of our mitochondria, which is only 10% of the equation, right? And so there's 90% of this unknown that is consuming what we're eating and turning it into all these intermediates and final waste products that could completely be mutagenic, or, and you're seeing cancer rates go sky high these days. You're seeing inflammatory diseases going sky high these days. And I think a lot of it's due to what we're feeding our microbes.
Yeah, talk to us about the process. So I know that there are different pathogens that drive decay versus
Yes.
drive perio.
Yes.
Does the diet seem to be affecting both similarly?
Yes. So, okay, so there's this massive food web in the mouth, and the primary eaters are the ones that can eat simple compounds like sucrose, fructose, lactose, glucose, all the oses, which are simpler sugars. They ferment or go through oxidative phosphorylation, which is fancy metabolic pathways to basically take that sugar, strip it down, harness the energy, and spew out organic acids like acetic acid, valeric acid, propionic acid, and butyric acid, which then feed the next phase of microbes that are linked to gum disease. So you have not only sugar, if you eat a high sugar diet, not only are you causing massive acid production by these little acid factories that coat every single surface of your mouth, but then they're also making the byproducts that are food sources for the next phase, which is the gum disease causing microbes. And you have these microbes that actually participate both in cavities and gum disease. And those are Candida and fungi, and no one's really talking about those guys as well. So it's not just the red complex or the purple complex or the orange complex or the green complex. It's actually a much more complicated food web that is driving inflammation, leaky gums, and demineralization in the mouth, based off of a heavy processed sugar, carbohydrate rich diet. And so that's why anything leafy and green that can be eaten throughout the day, proteins throughout the day that are different kinds of proteins, and super high fiber foods are fantastic for dental health. They enrich for a diverse ecosystem in the mouth, and patients tend to have less epithelial and mucosal inflammation, period, from mouth to anus. So it's associated with really good health.
Yeah, I can tell when looking at a patient's mouth who has a really clean diet, because I've started asking that question now. I'm like, man, your gums look amazing. They're just really firm. Yeah. There's no bleeding. The tissue's very stippled and tight. Tell me about your diet. And those are typically my whole food patients that are, very mindful. They're not doing a lot of sugar. They're not doing processed foods. Yeah, it's very apparent.
Yeah. But the thing is, if you have a high stress lifestyle, yep, you tend to produce a lot of cortisol. That has a tendency of enriching for certain kinds of microbes also, because they actually love that environment and use the cortisol. So a lot of Candida is found in patients that eat cleanly, but are super type A plus stress freaks. And they can have massive perio just because of who can grow in those situations and who likes those situations. So it's not just diet, it's also environment too, and stress. But boy, it's so much easier to control diet than it is stress.
Right, right, for sure. Yeah, and I let patients off the hook for that too, because they're telling me, I'm eating really well and I'm doing all my home care. And then I start asking, like, what's happening in life? How stressed are you? Oh, I'm really stressed. Okay.
Yeah.
Because a lot of people don't realize that we do secrete that cortisol into the sulcus area as well. It's flowing
Yeah.
throughout and it does feed those bad pathogens.
Yeah. Yep. A lot of, so there's, so microbes in the GI tract, again, the mouth is part of the GI tract that often gets ignored, is the fastest absorber. That's why some of the biggest angina meds are sublingual administration because it's really fast absorption. And so we have trillions of little factories that are secreting things and pumping things out every second of every minute of every day, and we're absorbing them, right? And so that's just kind of what I want to hit home is like the healthier, more diverse the microbial constituents are in the mouth, the overall healthier systemically and dentally someone's going to be. And you can't just even having some spirochetes can be perfectly tolerable if there's enough beneficial microbes around them that keep them at bay.
Right.
And in some publications that I've seen suggest that even like 1 to 3% of the entire compartment, if it's Porphyromonas of the certain aggressive strains, it's like the bully that turns all the neighboring microbes around it into bullies as well, and creates this really raucous environment that's very upsetting to the tissue and to the immune system, and also the nervous system. And no one's talking about the nervous system yet in gingival health, but that's also a big component. We've done a lot of memory care work. When those patients have really peripheral neuropathy, significant peripheral neuropathy, vascularization of the gingiva is super low, and the microbes there are a lot of fungus, saprophytes that are just eating that tissue. And so it's a really sad thing to see. And I don't, so the more you can prevent that, the better. Right. And they're linking a lot of dementias to a thing called type 3 diabetes. So we have type 1, which is autoimmune, type 2 is diet, and type 3 is diet also. And highly associate, both 2 and 3 are now associated with a lot of microbes that correlate strongly with gingivitis. So, because they like to create leakiness, because they need heme in order to survive. So there's a lot going on that we're still trying to understand. And you guys are literally in the trenches every day, really trying to keep things at bay.
We swim in it all day long.
Yeah. Yep.
Well, and I'm glad that you brought up the aspect of Candida, because my understanding in that is Candida is able to almost envelop the pathogens.
Oh,
is that accurate?
yeah. So in the mouth, there's a microbe called Malassezia. It covers a lot of us. It causes dandruff when it produces too much waste product. It's really pro-inflammatory. It hangs out in the sulcus. Candida does too, and then Aspergillus are some of the big ones we've been looking at, and they are interesting because they can form these little symbiotic relationships with the neighboring bacteria and really kind of almost act like a superorganism to do things.
Yeah, it's so scary how these things all work so well together.
Yeah.
One thing I do want to ask, because I know this has been, like you said, there's still a lot we don't know. There's still a lot we're learning. It's a very exciting time to be in dentistry. It's also a little nerve-wracking because as we learn all this, we're like, oh my gosh, what do we do about this?
Yeah.
And so I know one of the tactics that has come out, and I've been trying myself thus far, and I wanted some feedback from you as a microbiologist, is the concept of trying to use probiotics in the mouth. And the concept being, hey, we're going to get in there, we're going to disrupt this biofilm, we're going to, flush out as much of the pathogen as we can, and then see what we can rebuild with a probiotic. Tell me what your thoughts are on that.
Yeah, so in theory, probiotics make sense. In practice, what we've actually seen in our studies are that if someone has, or a dog, a cat, or a human, has a pathogenic biofilm. Could be super karyogenic or could be super periodontal. The microbes are spewing out antimicrobial agents. We're working on what they are. It looks like they're both protein and small molecule. And they're telling all the neighboring beneficial guys, they're giving them stop signals from a growth perspective. So they're actually inhibiting the growth of beneficial microbes. And we've done studies showing that we can take what they're secreting, put it on a ton of CFUs of viable lactobacillus or bifido probiotic strains. Those strains don't grow. They don't grow. And so what we've been doing is trying to stop the microbes from making those stop signals. And we can, in fact, when we pre-treat with our little dietary program, we're able to get outgrowth of the probiotics finally. So, and that might be why there has not been any real clinical evidence that probiotics work. And I mean, we've been working on probiotics. I'm a microbiologist, so they've been in the literature since I was in graduate school, and, applying it to skin or gut or now mouth and sinus. And there's very little statistical significance between the placebo and a probiotic so far to date.
Got it. Okay, so let's be honest, at this point, this conversation feels very heavy because, oh my gosh, all the tools that we have in our tool belt and everything we've been trying doesn't seem to have a real big long-term impact on really managing this very complicated biofilm. So I started this podcast saying I'm very excited to have you with us today because you have created something that's revolutionary. So let's talk about that. Tell us about what you have created and what it does and why it is effective.
Yeah. So when my grandmother had a stroke, I flew and grabbed her biofilm. I used my own biofilm, and then I used pretty much everybody I could get to give me a sample. And I literally did high throughput screening, and I bought everything on the market, triclosan, which used to be in Colgate, cetylpyridine chloride, which is in Crest. Fluoride, I got all the kinds of fluorides you can buy, detergents, everything. And then I also bought individual ingredients that are naturally safe. The whole list of GRAS ingredients that the FDA has, I bought every single one and did high throughput titration screening on our biofilms to see what can stop the growth of the bad and what can induce the growth of the good. And so we came up with a combination of naturally safe ingredients. One is called a postbiotic, technically. It's made by soil bacteria. It's like a non-fermentable molecule, so microbes can't break it down. But it's tricking them into thinking that it's sugar. And so their machinery is grabbing on, and it's too big, so they can't bring it in. And they don't have any equipment to cut it up because it's just dirt. It's indestructible. Like 98% passes right through the GI tract in people and animals. And so they're just in the bound state, starving of sugar. And then we're sending it prebiotics. One is vitamin B6, which is a cofactor that's essential for machinery involved in amino acid breakdown. And then we're also giving them the amino acid L-arginine to start breaking L-arginine down first. And that's stimulating what's called the urea cycle in bacteria, which generates nitrate, nitrite, and nitric oxide. And that's super important for gingival health because we're finding that a lot of perio patients their microbes are not making enough.
Right.
In fact, hardly any measurable amounts. And so we're actually causing the microbes to make it again and putting them on what's a little ketogenic diet, basically, not us, but just the oral microbes.
Right.
And that's having a reduction in inflammation. Obviously, you're sugar starving, so you're not going to make the organic acids. that are feeding the periopathogens and also causing demineralization of the enamel and then also leaky gums. So it's like a 1-2 punch of benefit that we've been working with now over 13 years.
That's incredible. What is the research showing you thus far?
Yeah, so we've done we've in memory care, we can eradicate multi-drug resistant microbes, including Candida, that's multi-drug resistant in the mouths of these patients, which helps their systemic health too, because bed sores, pneumonia rates, urinary tract infections, gut inflammation problems, all are linked somehow to the mouth. So by getting rid of the reservoir that is affecting the downstream inflammatory conditions or infections is actually a good thing for outcomes. And then in gingivitis patients, we showed that in 6 weeks, we were able to really statistically significantly block bleeding. So gum bleeding, BOP scores really significantly improved in comparison to sugar alcohols. Because we're asking ourselves, well, sugar alcohols are used all the time in oral hygiene products, and really what is their effect? Because theoretically, they're also affecting sugar in a different way as a decoy, right? How is that? How does that relate to the effect that our approach is having? And it is very different. So just by our approach, this little ketogenic diet, Protectin's able to literally block and reduce the red complex in patients in 6 weeks, correlates strongly with improvement in modified gingival index score and decreases in BOP scores, which is awesome. Interestingly, we've also got prelim data that suggests that sugar alcohols induce an exacerbation of gum erosion and detachment in that 6-week time frame compared to our Protectin approach, which actually increased or improved.
Wow.
Yeah.
Well, and I don't think we've really pointed this out yet, but the product that you've created, it's called Daily Dental Care.
Mhm.
And you just said something about Candida. So does it affect both the pathogens and Candida as well?
Yeah. So microbes like E. coli, strep, MRSA, other forms of staph, Klebsiella, Salmonella, Candida, they all use sugar to grow.
Got it. So what are the mechanisms of delivery for this product?
Yeah, so Daily Dental Care's got, right now we're out in the market with lozenges. Pretty soon we'll have mints, so people can just pop them. They're a cheaper version than the lozenge. We'll have water additives, so folks can be drinking it throughout the day, or add it to things to neutralize the microbes from taking in sugar and like sugary beverages and things like that. And then we're coming out with toothpaste as well.
Very exciting.
Yeah.
What's the recommendation for usage? Like you just said,
Yeah.
it can help neutralize stuff. So is this something that we do pre-meal, post-meal? Is it a once a day, twice a day? What does that look like?
Yeah. So in all of our work, all the data points to take it as much as you can throughout the day after you eat. Even before you eat is fine as well, as long as it's really close before you eat. But no one really likes to pop a mint before they eat lunch.
Right.
So, we're just saying immediately after, because there is that, 30-minute-ish, 25 to 30-minute-ish period of time where there's this massive conversion of dietary sugars to acid, after someone eats or drinks something that has sugar in it. So as soon as you're done eating, just pop it in, particularly if you can't, even if you can't brush your teeth. We've done some studies showing that even if you brush your teeth, you're just smearing the microbes around, but you're not changing what they're doing. They're
Right.
still going to ferment sugar, and you're going to, because of the way that the saliva works and the crevicular fluid works, there's a constant recirculating of fluids, right? So throughout the day, as you're digesting, the simpler sugars are going to wind up repopulating that crevicular fluid again, and the microbes get another meal. So they're continually feeding even though you're not actually eating, and that can last quite a while. So salivary pH drops, within 30 minutes after you eat, but crevicular pH, can go up and down and up and down and up and down based on how you're digesting and the food as it recycles back through the bloodstream and plasma into the crevicular fluids.
Yeah, that's really something that I hadn't thought much about, the long-term ramifications of that. So that's really cool.
Yeah, especially take it before you go to bed, because when you're sleeping, salivary production obviously goes down, which is a good thing. Otherwise, you'd choke all over yourself sleeping. But it really makes it you vulnerable, because they are churning out tons of waste products while you're sleeping, and you're just absorbing them passively through the mucosa. And so it's really important to continue to keep them blocked, because they're still feeding on that sugar that you ate for dinner. And that's what people really need to realize.
Yeah. So one thing we haven't really dug into a ton, but I know you've also created products for pets, for dogs and
Yes.
cats, because they also carry these pathogens. They also can have periodontal issues. And so I'm really interested in your research and study finding on those products, because we're talking a lot about diet here. A lot of dog food is made up of very simple carbohydrates. So they're, having those similar kind of diets with sugar, but dogs really don't tend to practice great home care. They're not brushing and
If any,
flossing.
I know.
So I feel like the findings for those products are especially interesting, because they're not even doing that piece.
Yeah. And you're absolutely right. So dental disease is through the roof in animals, in pets, because the kibble and the kibble recipes are just the worst thing that could happen to dogs. And all those dental chews on the market, full of wheat and rice and potato, which is like actually causing problems, not helping. And so in our questionnaires, about 2% of dog owners brush their dog's teeth regularly within a week's period. And then we're finding also that people are not washing the water bowls and the food dishes on a regular basis with soap and water. And that's just like yuck, right? And so yeah, our animal care line is called TEEF, TEEF for life. And the goal is to keep every single tooth in the mouth of an animal, because when you get a tooth pulled, lifespan shortens, and it's a sign of bigger problems. And so yeah, we've seen some really great results. I mean, up to 92% of middle-aged cats have either gingivitis or gum disease or stomatitis, and then about 80% of dogs by the age of 3 have gum disease, and that shortens their lifespan by about a third so far. So it's a big deal.
Yeah. And I help patients understand this too, that these pathogens are transmissible when we're giving treats, and
They're absolutely infectious, and then they lick your face, and you just, we've done household studies where we look at all the animals in the household and all the family members, human family members, and you can definitely see if there's a dog or a cat with gum disease, you can see those microbes start to spread within that household, and it is an infectious disease. Gum disease is infectious. And that's what I wish the WHO recognized, that. They consider it still a non-communicable disease, but it really is communicable.
Right. Well, I'm very, very excited to dig in and try this with my own family and my own practice. And I'm hoping that my listeners are going to also be like, oh my gosh, we got to try this out. So I know things are still in the works, but where can we find your product? And is there a wholesale route for dental offices specifically?
Yes, and yes. So you can find us at primalhealthllc.com, and that's P as in Paul, RIM as in Mary, AL. Health, obviously, LLC, because we are an LLC corporation, .com. I promise we'll get a little bit more improved in our SEO, but there are 2 formulations that are now clinically validated. One is Fosnate for humans, the other one is Protectin for humans. And then there's also a hyperlink to TEEF if folks want to investigate Protectin 42 and 30 for dogs and cats respectively. But We do offer wholesale pricing. We do also offer affiliate programs. So we'll just drop ship to clients' homes. And then there's a monthly checks we send out to our affiliates. So we're, and we're also open to white labeling as well. So, because I recognize some dental offices really like branded products that reflect their own professional brand. And so we're open to everything. Our goal is to get our technology in the mouths of everyone as often as possible. So our business model reflects that.
Awesome. Well, I'm so grateful for your passion, your ingenuity, and your drive to think outside of the box and come up with such a smart and foundational idea that can have a monumental impact to dentistry and patient health. In light of the enormity of what we're up against when it comes to the biofilm, the complexities and the westernized diet that we're faced with, this concept is truly revolutionary. And I hope all of our listeners will dig in and check out daily dental care for themselves and their patients. I know I will. Thank you so much for your time today. Where can listeners reach you if they have any questions?
Yeah, so you can email us at info@primaltx.com, primal, and then TX, T is in Tom, X is in X-ray, or info@dailydentalcares.com.
Awesome. Check it out, you guys. I think this is the next big thing coming in dentistry and hygiene. We're going to help our patients the best we can. So we know better. Now it's time to do better. Thank you so much, Dr. Stein, for joining us today. I really appreciate it.
Thank you so much.